Mr. Premier, Minister Gordon, distinguished guests, board members, and staff. I am Brian Schoonbaert, CEO for Prairie Mountain Health, and it's my great privilege to welcome you all here today. Prairie Mountain Health acknowledges that today we are on treaty territory and on the homeland of the Métis Nation. We acknowledge that Manitoba includes the original lands and traditional territories of the Anishinaabe, Cree, Dakota, Ojibwe, Oji-Cree, Dene, Inuit, and homelands of the Métis. Prairie Mountain Health respects the treaties that were made on these territories, and we acknowledge the harms and mistakes of the past. We dedicate ourselves to continued collaboration in partnership with First Nation, Métis, and Inuit communities in the spirit of reconciliation and collaboration. And now, it's my honor to introduce and welcome Honorable Audrey Gordon, Acting Minister of Health and Seniors Care and Minister of Mental Health, Wellness and Recovery. Minister.
Good morning, everyone, and thank you, Brian, for the introduction. And thank you to everyone here joining us for this exciting announcement today. I'm honored to have recently been appointed the Minister of Health and Seniors Care, and some of you may recall that I spent about a little over 10 years working in the Winnipeg Regional Health Authority with many different healthcare stakeholders. And so I want to take this opportunity to thank all the healthcare providers and staff across our beautiful province who have worked extremely hard to continue to provide quality care throughout the pandemic. I'm also excited to be here for this historic announcement that I'm sure will improve quality of care for all Manitobans, not only now, but well into the future. Investing in healthcare services in communities throughout Manitoba will not only improve the physical health and well-being of Manitobans, but their mental health as well. This announcement today is a part of Manitoba's Clinical Preventative Services Plan, which was developed and led by clinical leaders and health system experts from across the province. Detailed planning looked at population growth and community health needs, distance to specialized 24/7 health services, and the stability and reliability of the province's health workforce. I'm extremely happy to be a part of the exciting time for Brandon Regional Health Centre. And with that, I would like to introduce Premier Brian Pallister. Thank you.
Morning, everybody. Friends of Healthcare, friends of Brandon and Westman. Honor to be here with you today. If I might, thank you, Audrey, very much for the introduction, and Audrey will do a tremendous job as our new Minister of Health. And I want to say how much I've been impressed, and I know all our colleagues who are here with us today have been impressed with Audrey's support, her work ethic, her intelligence, her integrity. And so, Audrey, all the best to you in your role. And Brian, to you and your team, thank you so much for your efforts on behalf of all of your patients and your support for healthcare in this community and in this region more broadly. We really appreciate it. So pass that thanks on if you would.
I will.
Also pleased to be joined today by several of my colleagues, and I see Doyle Panyuk here, and Doyle, thank you, great to see you, and Blaine Peterson. Len Eastleson is here, of course, and also Greg Nesbitt is with us. And my former student from Neelan High School, I see, who turned out very well, and I thank Rick Crest for being here. It's been a privilege and a pleasure, Rick, to work with you in your time and prior to your time in other roles in partnership, building Brandon, building Westman. So let's hear it for Rick Crest and his council. I thank you, Rick. And so many others who are here, we owe real thanks to. Through this pandemic, we've seen how healthcare teams have been able to work in spite of the incredible, and as a consequence of the incredible challenges that we've had to face together to serve the needs of Manitobans and those as well who are visiting our province from elsewhere on occasion. And so I look at you, Lanette, and say thank you so much for your leadership through this process, and to Dr. Roussin and your teams, because this has been a tremendous challenge for all of us, but tremendously important for the people of Manitoba, and you've risen to that challenge. So thank you so much for what you've done. So it is a pleasure to be here in my adopted hometown of Brandon and say welcome to everyone. The future of healthcare in Manitoba is better because of what we're doing and what we're going to be announcing today. I want to also say that since we took office in 2016, we've maintained the most significant investments of any Canadian province per capita in education, families, and in healthcare, number one. And we do that because we believe those are the priority areas that need to be served. These are the vulnerable people we need to care for. And our vision for healthcare is a bold one. It's a transformative vision. It's based on improving access to healthcare. It's based on reducing wait times. And it's based on making sure that services are available closer to home. I see some media here today who have come from Winnipeg, and I thank them for being here today. But they know that that trip, as hard as it might have been for them, is made much harder when people have to travel from Westman into Winnipeg or from the Parkland into Winnipeg when they need health care. Our vision for the future of health care involves a lot less of that. A lot less of services closer to home, accessible to people when they need them and where they need those services. And it's better for their families too, in support of those patients who will need that care, to make it available closer to home. So today, we take a significant step forward in achieving these goals. It gives me great pleasure today to announce our government's historic record investment of nearly $812 million to build, renew, and expand our healthcare sites right across Manitoba and improve the quality of care for all Manitobans now and well into the future as well. This commitment today is the largest health care commitment in the history of the province of Manitoba, and it is going to support 38 projects in all regions of our province. It will form the foundation of Manitoba's new Provincial Clinical Network. Now, this is a system, Lanette will tell you more about it, I think, in a minute, but this is a system that will allow health services to be more accessible, enhance their quality and the reliability of care, and reduce, as I mentioned earlier, our provincial wait times. Now, these initiatives have been identified as part of Manitoba's Clinical and Preventative Services Plan. And I should mention that this plan was developed and led by our clinical leaders and our public health system experts from all across the province of Manitoba. These 38 projects will include some new facilities. They will also include renovations and expansions to existing ones. They will greatly reduce the need for many patients and their families to have to travel long distances for care by providing more services in the community that is closer to home. And that brings me to the second part of today's historic $812 million announcement. I'm pleased to share that approximately $70 million will be committed to enhancing health services right here in Brandon by establishing the Brandon Regional Health Centre as a centralized hub of specialized services for Westman. This $70 million investment will support two major advancements. One, the expansion and renovation of clinical spaces within the health centre, and secondly, enhance cancer services at the Western Manitoba Cancer Centre. Construction on these Brandon projects is expected to begin next year and will be completed by the summer of 2025. Congratulations, Brandon. Now, I get a little defensive because I know the internet's alive with intelligent comment, but some of it isn't that intelligent. Some of it has said that I favor Brandon too much. And I just have to add today that this is part of a clinical plan that was developed by our health experts and is not politically led in any way, shape, or form. And I would secondly say that it builds on other major infrastructure announcements that we have made since we came to office at health facilities throughout the province. And just to give you some examples, those would include construction of the Selkirk Regional Health Centre, new emergency departments in Flin Flon, new emergency department at the PA, Winnipeg's Grace Hospital, St. Boniface Hospital in Winnipeg. These are province-wide improvements, and they're being made because accessing the healthcare system, whether it be for a test, a diagnosis, or treatment, can be stressful. It can be scary. We all know that. But now, imagine if you have to leave the comforts of your own home, your own neighborhood, and move to somewhere else halfway across the province or further. That just adds to that stress. Alleviating that stress and making these services available to people all across the province is the right thing to do, and I am confident that by investing in healthcare services in communities throughout Manitoba will not only improve the physical health and well-being of Manitobans, but as Audrey alluded to, will improve their mental health as well by reducing the degree of stress that is inherent in having health issues. So as someone from central Manitoba and western Manitoba who has attended university here in Brandon University, I am proud to say that I know how well the community and the region of Westman in our province works together. Community development and community work on healthcare and many other community issues is central to our success here, and it's been central to our success throughout the history of this area. Healthcare is no different. And so today's announcement and these targeted initiatives are going to build up Brandon as a healthcare hub, offering Westman people many services that currently require driving to Winnipeg. Our government's investing in better health care. We're investing in health and well-being of the people and communities of all our province. Today's a great day for the future of health care in Manitoba, and as I always say, and today is indicative of it, the only thing better than today in Manitoba is going to be tomorrow in Manitoba. Thank you.
Thank you so much, Mr. Premier. Manitoba's Clinical and Preventative Services Plan has been developed by clinical leaders and health system experts from across the province, just like the Premier mentioned, of which Prairie Mountain Health has been happy to participate. Our staff and physicians have been all along the way. Two of the many goals of the Clinical and Preventative Services Plan is providing for a coordinated and consistent care approach to be applied across the province. And secondly, looking for ways to improve healthcare access and capacity within our large, geographically diverse province. Further to those aims, today's announcement is the next step for the Brandon Regional Health Centre's exciting future role as the province's intermediate hub for Western Manitoba. The enhancements planned for the Brandon Regional Health Centre's intensive care unit, neonatal intensive care unit, and the new additional medicine beds will provide the necessary infrastructure and supports to continue to provide excellent care to our patients, clients, and residents. Brandon Regional Health Centre has always been proud to serve the communities in which it supports all around, and we are excited to be able to continue this service in an expanded way. Our planning for these expansions will be built upon and consistent with the province's care models and will be based on the latest research in care environments to best support recovery, wellness, and family involvement in care. By increasing our capacity in both the ICU and NICU, we will have the ability to care and manage more critically ill adults and infants closer to home. I would now like to introduce Lanette Siragusa, Chief Nursing Officer, Provincial Lead of Health Service Integration and Quality for Shared Health. Lanette.
Good morning, everyone, and thank you to the Premier for inviting me here to Brandon for this very exciting announcement. As the Premier has shared already, these investments in health capital infrastructure will build the foundation for better health services in our province. Manitoba's Clinical and Preventive Service Plan is our roadmap for better care. It outlines the need for improved access, quality, and equity across our health system, shorter wait times, as well as the ability to provide services closer to home. The plan and its recommendations were developed by clinical experts and health system leaders from across the province, and it also includes feedback from thousands of Manitobans, both healthcare workers and community leaders, as well as advisory groups. It's based on evidence and it's based on data, and it is also informed by local clinicians who know what their communities need now and going into the future. It has been a long 18 months since we first announced the Clinical and Preventive Service Plan. Feels like forever, actually. And the pandemic has enabled us in some ways to come together closely to collaborate and find innovative solutions to provide care and a response for our Manitoba citizens. It's also, though, highlighted gaps that have been in our system for a long time and new challenges that have arisen, which we need to address now. We know that we can do better for Manitoba patients, and we know that we can improve services for people who live in rural, northern, and remote communities, so that your access to healthcare services are not just reliant on where you live. The plan includes investments to support healthy aging, as well as resources that will help better manage chronic disease, which we know is rising in our province. We are celebrating here in Brandon today investments that will build up critical care capacity in our province overall, but will also allow us to provide care for our sickest and our smallest patients in Brandon through the skilled teams working in the ICU as well as the NICU. These ICU investments, by allowing to expand the service here, will also have ripple effects in that the types of surgery we provide, the capacity for surgical patients will also be enhanced. And the investments in cancer care services so that Manitobans who are receiving treatment can do so now much closer to home. Clinical teams have been providing input into these capital investments and health service improvements that will be supported by the $812 million investment. There is more to come, and I am very optimistic about the improvements that we are going to make for Manitobans. And over the coming weeks, we will be meeting with more experts and healthcare providers and community leaders, Indigenous partners, other Manitobans who will help us inform what the services will look like and how we make sure that we are able to address the unique needs of the population we serve. This is Manitoba's plan. It will be implemented in stages with meaningful consultation to make sure that we achieve the improved outcomes that we aim to achieve. As Manitobans, we all have a stake and a role in ensuring that our healthcare system can deliver the best care possible. The clinical teams and leaders involved in the development of the clinical plan, its recommendations, and these investments are committed to building a better healthcare system. And I am thankful for the efforts of all the teams and the individuals who have contributed to this work so far. And I look forward to the voices and the contributions of others yet to come. Thank you very much.
Thank you, Lanette. And now I'd like to introduce Dr. Piotr Czaykowski, Provincial Medical Lead, Oncology and Hematology for Cancer Care Manitoba, to say a few words. Thank you.
Good morning, and thank you very much. Thank you, Premier Pallister, Minister Gordon, Mr. Schoonbaert, and Ms. Siragusa. On behalf of Cancer Care Manitoba's CEO, Dr. Srinavatnam, I bring greetings to all of you. Just a little bit of history. In the late 1970s, the Manitoba Cancer Treatment and Research Foundation pioneered the delivery of cancer drug treatment closer to home through its community outreach programs and through working very closely with very dedicated rural family physicians and with all of our regional partners. Since 2011, Cancer Care Manitoba has been able to provide radiotherapy treatments closer to home for those in Western Manitoba through the Western Manitoba Cancer Centre here in Brandon. With the investment announced today, building up a specialized service hub, we are well on the way to being able to expand the services we provide to Western Manitobans. With a new bunker and a new linear accelerator radiation machine, we will have increased confidence in the sustainability of our radiation treatment delivery. It will be easier for us to manage planned and unplanned machine downtime. The new machine will also permit us to provide more sophisticated radiation treatment that in many instances will mean shorter, more convenient treatment plans, and will further reduce the need for patients to travel to Winnipeg for treatment. With the expansion of the Western Manitoba Cancer Centre's physical space, we will also be able to realize a long-standing goal of moving more specialized cancer care to Brandon. We are very excited to have recruited an enthusiastic Western Manitoba born and bred medical oncologist who will be starting his practice alongside our 2 radiation oncologists and alongside our outstanding crew of family physicians in oncology who already provide care here. In the future, we envision bringing additional cancer and blood disorder specialists to Manitoba's second largest population hub. The announcement today paves the way for this to become a reality. Although we are talking today about increasing resources in Western Manitoba, we really have to emphasize that this has implications for all Manitobans as it allows us to increase capacity in the system as a whole. There is close alignment between the province's clinical and preventive services plan and Cancer Care Manitoba's provincial approach to care. The roadmap to cancer control for Manitoba calls for patient-centered and community-centered care. We are talking about providing timely access to high-quality care closer to the patient's home and, importantly, to their support systems. The integration that the province's clinical service plan promises will strengthen and ensure formalized pathways provincially that will improve timeliness, improve the patient experience, and improve outcomes. We anticipate better integration between cancer care clinical staff and the other services so important to cancer care, diagnostic services such as radiology, laboratory medicine and pathology, and clinical services such as surgery, internal medicine, and palliative care. This integration will provide a net benefit to all of our patients. Historically, healthcare has been planned in silos. The clinical plan will break down these silos and bring linkages that allow for more successful and efficient provincial planning. I don't think I need to remind you that nearly half of us, think about that, nearly half of us will be diagnosed with cancer in our lifetime, and essentially all of us will be touched by cancer in some form. Provincially, nationally, globally, we need to be ready for the projected steady rise in cancer diagnoses and the ever-increasing time patients live with their cancer. Working together provincially and expanding our ability to deliver high-quality cancer services is a step in the right direction to achieving cancer control in our province, in improving the patient experience, and providing better care for all Manitobans. So thank you again for the opportunity of acknowledging this great investment.
Thanks, Doctor.
Thank you, Dr. Jakovsky. This brings us to a close today, but before I wrap up, I'd like to take this opportunity to again thanks to Premier Pallister for this great announcement for Brandon, and thank you everyone for being here today. However, it would be amiss if I didn't take this opportunity to acknowledge the staff in Prairie Mountain Health. As the Premier mentioned right at the beginning, it has been through our staff that we have been able to meet the demands of the pandemic over these last number of months. They have gone above and beyond, answered the call of duty through these extremely busy and challenging times. A sincere thank you to all the staff for their dedication to our patients, clients, and residents that we serve each and every day. Thank you again, and we'll be taking some questions at this point.
How much of the money announced today will be used to improve staffing shortages?
Who wants to take that one?
I can speak to that. So the announcement today is specifically for the capital infrastructure, the bricks and mortar that we're going to build to provide better support, better services for patients and the people of Western Manitoba here. There will be separate, there is already been announcements about the internationally educated nurses, as well as additional 400 seats per year for nursing. So more will be ongoing, but that is a separate announcement for that.
What were the other announcements for other medical facilities in Western that will help augment some of the regional
Yes, there will be some announcements. They will be later. This is the first of the announcements today.
designing physical spaces for new medical capital projects. How has the pandemic changed the actual physical design of facilities?
That's a very good question. I think maybe I'll just mention that, of course, it is based on the latest research in wellness and care. The pandemic definitely has taught us a lot over the last number of months, and we will definitely and have already incorporated some of those thoughts and I guess, experiences over the last number of months. Do you want to mention anything specific?
No, I would just say the expansion to the ICU was part of the clinical plan 18 months ago, but you're right, with everything that's happened related to the pandemic, there probably is a closer eye. There always is an eye on infection prevention and control, but certainly having experienced what we've been through, that will be part of the planning as well. Well, what we need to do is make sure we have that flexible capacity, both in the space and the equipment and the staffing, as we always have, so that we can wax and wane when we need to. Yeah.
The backgrounder in that press release talks about how the pandemic and the fight with COVID-19 kind of sped up the process to bring this announcement forward.
Mm-hmm.
How much to the fore? What was the need to bring it faster for this the changes needed to the improvements?
Right. So the clinical plan was a guiding document, a direction where we wanted to go, but because of the situation with the pandemic, it really highlighted to us what the first priorities need to be in the plan. So as I said, we always had ICU building more capacity in Brandon, but because of the pandemic, that was expedited as well. And as we continue to make announcements and stage out the capital investments and the services that go with it, you will see that there is close ties with COVID and the impacts that we've experienced over the past 18 months.
Okay, well, thank you very much. Thank you for coming out today, and stay safe.
Thanks, Rob. Thanks very much. Welcome to those who have come from outside the city of Winnipeg to Brandon. The road isn't uphill, is it? It's pretty flat. Thought I'd mention that.
A large part of your caucus has made their feelings clear on Bill 64. What's the future of Bill 64 and the other bills now before the legislature?
Future will be determined by my successor. I have sent a message to the Executive Council that are gathering, I understand, later today, that I will in no way, shape, or form take any part in the process of selecting a successor. I think that's important. It's important because we have a province to run, and I will maintain my focus on that, as will the Deputy Premier's office. So none of our staff, my family, nor I will be involved in any aspect of the leadership contest, nor will we be commenting on any aspect of the leadership contest. Legislative agenda is as it is. The bills have passed various processes. There are more to come. But once I made the decision that I was stepping down, I can't reach up from beyond and control that process. Well, I'll be letting you know first of all, Steve, and exactly, you'll be among the first to know. I've been consistent in this. I hope you'd agree that I've kept my promises to you. I've endeavored to be available to you. I've missed you the last couple of weeks, and I'm pleased to hear some of you comment that you've missed me too. So thank you so much for that. I'll let you know on my specific intentions, and I'm sure that, as I said earlier, the team of people that we have in place, that is a very capable group of people, Cabinet and caucus, and staff, I should mention, are going to be rededicating themselves to the goal of building a stronger Manitoba, just as we've been for the last 5.5 years in government. Well, I haven't made any reference to any specific times because I don't know what the times are that the party is going to establish, nor do I have any involvement or role in that. And so I understand that they're having a discussion tonight. I've recorded a message to go. I want to be really clear on this because all of you who have followed politics know the harm that can come as a consequence of interference or meddling in a process that should be neutral and independent. So I don't want to be part of any of the meddling. I am not going to be involved in that, and I'm sending a very clear message that I've taped that message already to go to the Executive Council for their meeting tonight. But I do understand enough of the process, not my first rodeo, so I understand that they're going to be discussing a variety of aspects of the process. I just want to be very clear to Manitobans, I'm not going to be involved in that process or the determinations. So I can't comment on the timing of a vote. That's entirely up to the party's Executive Council to make the decisions around that. Well, I might have answered that question, but since you've referenced leadership candidates, Jeff, I will not and cannot, and you understand why. Are you disappointed Bill 64 appears to be dead? I understand that change is hard. We've been a transformative government. We've pursued an agenda of ambitious change. You know this in every file, quite frankly, in government. Not bragging, I'm just saying. You know, we inherited a mess. We've worked really, really hard to clean it up. We've made some really good progress. And obviously, I believe that a stronger education system is possible, and it's something that I think we should be pursuing for the benefit of our children. So I'll stop there and simply say the purpose of our legislative agenda was to move Manitoba forward. That purpose will be, I'm sure, pursued by my successor and our colleagues, and I won't be involved in the degree to which they pursue various files. That will be their choice and their decision. No, I'm running the show right now, and I plan on continuing to, and that's why I'm not taking any more of your questions. We're going to go to somebody else now. Steve, how's that? Just to prove I'm running the show.
How many have any members of your cabinet been removed from cabinet or have been asked to leave cabinet as a result of after last week where they showed so much support for this?
No. None, no. We have a pretty diverse group of strong-willed people, and despite comments to the contrary, we have welcomed that diversity in our discussions. However, we've also been unanimous in respecting one another in terms of things like cabinet solidarity, as you well know, with very, very few exceptions. I'm sorry? I won't talk about the leadership contest in any way, shape, or form, and I think you've got that point now pretty clearly. No, wait, I said I've got to keep my promises. I said I wasn't going to take any more of your questions, Steve, so I'll go to Jeff now. Sure. Now, you're asking his question for him?
You say you're in charge.
Okay, just to be clear.
You say you're in charge. Are you going to be in charge of the legislative agenda?
I think it's very clear that we have bills that have advanced to the point where they can be brought forward, but there's also very clear that my successor will have the opportunity to take various changes to heart, as will the Cabinet and caucus, as they always do. And so, I can't comment on any aspect of the leadership contest, but I can tell you, and you're quite familiar with this, that bills have been withdrawn, bills have been amended, and bills have been altered in various ways. That's in part why we have a committee structure to examine bills. So this particular bill that you've alluded to is the education bill. It's not something that was drawn up on the back of a napkin. It's the result of several years of intensive consultation and work by a great number of Manitobans. And so, out of respect for their work, I would think it makes sense for further discussion on the possibilities there. But again, by offering the decision I have made after 29 years to step aside, I'm endeavoring to make sure Manitobans have a chance to get to know my successor. And so in saying that, I think it would be wrong for me to suddenly say I want the successor to do everything I want. So I'm not saying that. I've made the decision to step aside. I'm running the province of Manitoba in concert with people like the medical team that you saw today and heard from, who have done most impressive work, with colleagues who I believe in and who I trust and love. And I'll continue to do that as long as I'm capable of doing it until further decisions are made.
Premier, this is a clear sign that you're gone by the end of October, given the legislative timetable, the need for public hearings, Manitoba.
Well, I'll let you know the date when I let you know, and then we can talk about that date with some certainty instead of speculating on it. Yes, hi, Matt.
So,
It's great we have the barbershops open now.
I know, aren't they great? My wife was telling me I look around 20 years younger.
You know, I can't tell.
I was going to ask you if you're not going to be commenting on the process, choosing a new leader. What will you be doing until the end of the term?
Oh, well, I've got a variety of exciting events planned. I'm continuing to engage in the work of governing. There's a lot that's going on right now, as you know. Thank goodness for this recent rain. In most respects, it's been helpful with regard to the forest fires. It's given a lot of our farmers not hope for this hay crop this year, but given them hope that the water table will be up sufficiently that they might even put fertilizer on this fall. So, you know, overall good news, but we're certainly monitoring those situations, and we're not out of this pandemic yet. And I think rumors to the contrary are most unproductive and unhelpful. We have incredible challenges with respect to the pandemic that remain and that are growing all around us. Let's face it, if you monitor the numbers elsewhere, you're seeing record cases since, I think the highest in Ontario this weekend since June, if I recall. And so we have a lot of work we continue to do, and we'll continue to do that work. I do plan on being in Brandon at least on one more occasion before I leave, so I will plant that seed.
On that note, when we're talking about the rise of the Delta variant all the way around that,
That's correct.
are you looking at having to re-implement a mask mandate across the country?
But more to say on that tomorrow. Dr. Russin and I are going out tomorrow. And certainly you've got to be adaptable with this. Just as our health team alluded to the adaptability of our plan as a consequence of the pandemic, certainly that additional knowledge, sad as it is. And I'm with Lanette when she says a year and a half, it's hard to believe. A year and a half since this pandemic really struck here. It seems to me like 15 years ago, really, to a lot of us, I think. But we've learned a lot through this process. There's a lot of learning that's happened. I'm not trying to polish something that isn't polishable. I'm just saying the adaptability of our government, and not just senior people, but right down to the front line, has been put on display through this. We have had lots of sadness and lots of setbacks, but we've also had some tremendous progress as a consequence. And so I think it's really important to understand that and to look ahead and learn from every passing experience and see if we can't do better going forward. So that's what we'll talk about tomorrow. That's correct. None of our bills were. We don't use napkins for our bills.
So, and you talked about, the process could include, in general, legislation changes, aka amendments. So, would your preference be in opposition to the bill? Would your preference be to see amendments instead of it just being scrapped?
My preference would be for us to have a better education system in this province that serves our families better, serves our parents and children better, most importantly, and that is offering better input and opportunities for our communities. That's what I would like to see. And beyond that, I won't get into the specifics of the bill. There are various ways to achieve these changes. I should say that. This bill is one of them. There are certainly others as well, to be fair. But again, I don't wish to be drawn into a situation where it's just too easy for people to assume there's conflict that exists when such is not the case.
The idea of a different education formula change that doesn't have that much, all those details packed in, putting various pieces in something.
Yeah, it's the trouble with it's not an omnibus bill, that's not a fair statement, but it's an incredibly complex piece of legislation. It's very large. And I know the challenge with that, with being overly ambitious sometimes, is that you can be set back because of the complexity of the monumental nature of the challenge it presents. I understand that, too, there are people who certainly are fearful of change, and in a pandemic, I think that's an understandable reaction. And I also understand there are folks who like to preserve the status quo. I'm not a status quo guy. I haven't been a status quo guy since I took this job. As opposition leader, I wasn't a status quo guy. I think we can do better. So for our children's sake, I think we can have a better education system in Manitoba.
Is it a mistake to propose eliminating all electricity? Because if not, people in rural Manitoba, the city of Brandon, there's lawn signs opposing this system. Is that a mistake?
Lawn signs are up in every election, and they've been up now, principally supplied by opposition to the bill and opposition to the PC government in Manitoba. Let's be honest about that. It's easy to oppose change. It's harder to advance progress. I choose to advance progress.
Premier and Heather Stephenson's leadership announcement, she said it was clear to her that Manitobans don't want Bill 64, and 2/3 of your caucus applauded that. Have you come to the same conclusion that they have?
I've come to the conclusion that no matter how many times I say it, you're not going to listen to me, and that is frustrating. I've told you I'm not commenting on a leadership contest, so I'm not going to start commenting on a leadership contest now.
But I'm not
Okay.
asking you.
Yes, you are. You did, and you're going to do it again, and I will not respond. To be fair, look, I'm asking you to understand the damage that can be done to my party, and I am the leader of the PC party in Manitoba, by a divisive contest that is interfered with by a current premier is enormous, and I will not be part of that divisiveness. I'm not going to comment on a leadership contest.
You still support Bill 64?
Yes.
Will there be a prorogation?
I'm sorry?
Will there be a prorogation?
Not by me, but that would be a decision by my successor, and you'll have to ask them.
So that's a decision. It's a next question. If it's a decision by your successor, I would suggest you not in charge of this session.
Well, look,
Timing stuff.
you've got me, Jeff. I'm working. It is a fair question. I'm working on the assumption that the Executive Council will make a decision to have a leadership vote at some point in the next few weeks. They may decide not to have that leadership vote until 2023 spring, in which case I'll be answering differently probably. But I don't know that because I don't know what the Executive Council decision will be tonight. So you got me. I was working on the assumption there'd probably be a successor chosen at some point this year. That's what I was working on. Yeah. Thanks, guys. We got a great announcement in Portage in 1 hour, and it's 1 hour and 17 minutes from here. Sorry, Bartley, go ahead. Well, I was reading your book on the weekend, and it puts me in a jovial mood because it is such a good book. And if anyone here hasn't got it, talk to Bartley. It's available. You can get copies. He has boxes of them in his basement.
My question is, if you're here, having made that announcement 2 weeks ago, you described
Oh, you know, it was an awfully difficult decision to get into politics in the first place for our family. It was just tremendously difficult. And then I had the decision to make as to whether to leave provincial cabinet and run for a two-person party. And that was an awfully tough decision too. And then I had the decision to try to push forward on the idea of a reunion of conservative factions in the country so we could get back to accountable government in Ottawa, and that was a tough decision. And then I had to decide, after I thought I'd retired from Ottawa, whether I should get back after 4 consecutive losses by the Progressive Conservative Party of Manitoba, and I felt it was important, and that was a difficult decision. So this is perhaps the most difficult decision of all.